You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth, a permanent set of teeth in just a few appointments. With us, we have an expert on the topic, periodontist, Dr. Daley. Dr. Daley, welcome to the program.
Oh, thank you. Thank you.
All right, now before we get into today's topic, you have a large practice. Tell us, who's your typical patient and what do you spend your time doing throughout the day?
I spend my time working with over 200 different dentists who refer as patients.
Okay.
And they refer it for a variety of reasons, where it's to get the dental implant that we'll be talking about. They got a gummy smile. They have infection in the gum tissue, where they have trouble sleeping because the airway closes at night. We treat those type of patients.
Okay, so you sleep apnea
Yes.
kind of things as well?
Yes.
All right.
With joint problems, we have a TMJ specialist in the office.
All right.
And she's been with me for over 20 years. My two associates have also been with me for many years. We have a team of hygienists to keep you well once we get you there.
Okay, okay.
And so for anything to do with the structures that hold the teeth in.
So the gums, the periodontist is like the gum specialist. Is that right?
Yeah, we call it the gums, but it's really dealing with the bone because that's what holds everything together.
All right.
And that's why they refer patients to us for the bleeding gums, for the loose teeth, to secure the dentures, to do dental implants. And
so the denture wearers now are coming to see you guys?
All the time.
And so it's become mainstream.
Oh, very much so. And it's one of the most rewarding things we do because there's nothing more devastating than losing all your teeth and all the problems that become with this deformity, with your speech and your eating. And, with a good set of dentures, you only have 15% of your bite. And can you imagine if you can increase that so you can bite into an apple, that you can take a piece of rib and rip the meat off of that rib? Well,
it's a big difference.
Well, a big difference.
Now, people don't like going to the dentist, especially, I guess, the specialist, right? Do you hear that?
Every day. But at the end of the treatment, at the end of the appointment, they always say, thank you. I really appreciate what you have done for me. I feel better. I feel healthier. Yeah. We hear that every day, and we know we are helping these people. We care about them.
Really? Okay.
And we want to help them, and they appreciate what we do for them.
Now, how long have you been practicing in the town where you are?
Over 30 years.
About 30 years.
Before that, I went to Case Western Reserve, and I taught at Northwestern University. Then I came to Baltimore to teach at the University of Maryland, and I'm still connected with them. I still lecture there. In fact, some of the students nominated me for Alumni of the Year.
Okay.
And
now, isn't the local magazine, you get voted like top dentist, top periodontist out there, is that right?
3 times they have surveyed 1,000 dentists. 3 times I've been a top dentist. Yes.
Why do you think that is, by the way? Well, that means that the other dentists must like you.
That's why I feel very appreciative. I think it's because they see the results when the patients go back. The patients comment on how well we treat them, how much we cared for them. They like the office. It's not just me to be top dentist. It's the whole staff. It's the whole atmosphere. We really try so hard to meet that patient's needs.
Okay, then you teach other dentists right now. You're in charge of a study club.
I'm in charge of the director of the Seattle Study Club. It's an international study club. It's the most prestigious study club out there. And yes, I do teach, and I've been teaching for my whole career, where it was full-time at the university or part-time. I run in and give a lecture at different universities. I lecture to county dental societies. I enjoy that.
Do you talk about dental implants now? Is that one of your topics?
Oh, of course.
Is that right? Now, at the top of the show, when we said no more dentures, do you think that's the future of dentistry? Dentures as we know them now will all be secured by something?
It is the future. And that is why I'm here.
Okay.
Because I want to get the word out. Can I tell you a story?
Sure.
My mother was one of 9 children.
Okay.
Bethlehem, Pennsylvania, where they grew up. Grandma was sent the kids out to collect coal along the railroad track. They'd come back, light the stove with the coal, warm the house. One day she got caught in the rain. Developed rheumatic fever. Back in the 20s and 30s, they didn't have penicillin. Damaged mitral valve damage.
Okay.
Scar tissue on the heart. So what happens in 1948, fast forward 25 years, she's at Cleveland Clinic, where ironically I trained at later on.
Okay.
And they said, well, your gums are separating. You're starting to get infection of the gums, which we easily treat every day nowadays.
Okay.
That's why I treat day in and day out infections of gums so you don't lose your teeth. But in 1948, they pulled all her teeth because they knew that infection of the gums led to 2 or 3 times more heart attacks.
Okay.
Nowadays, we would not do that. So my mother had dentures. My father had dentures. So as I'm growing up, the meals were meatloaf, mashed potatoes, soft foods. I saw them oversalt food, put extra.
Is that when you knew you wanted to be a dentist, by the way?
No. I graduated in chemistry and went to the hospital, and that's when I decided I wanted to be a dentist. I decided I want to go in the medical field and help people and care about them, but I didn't want to be a physician. And dentistry, wow, it's been perfect for me.
Did you ever get a chance to help your parents with dental implants?
No, that's why I'm here today. Because I've been helping people time and time again. You have asked me to be on the program.
Yeah, that's true.
And I say, no, I'm busy. But we got to get the word out. Because I wish I could help my parents with these dental implants the way I'm helping patients every day, to secure so they can chew, so they don't have to put extra sauce on, that they can taste food again, that they don't have to have these expensive relines and put all that goop on their denture. No.
Is it true, though, with just 2 dental implants, you could give a denture something that securely snaps in and snaps out?
Do you want to hear it? I can let you hear the truth
all right,
here.
All right.
So here's a denture, and put 2 implants in. You can see them in a bar, and just 2 implants, snap.
Nice. Okay,
I don't know if
let me take a look at that. So is this authentic? I mean, this is how it really, it's pretty tight there. I'm not trying to exaggerate for you.
Yeah.
So they get a full set of teeth, can snap in, snap out. They can eat, they can chew.
They don't have to worry about when they eat some caramel candy or something, or some gummy bears that's going to move their denture. One patient we had recently is a skydiver, and she had a partial denture, and was always worried skydiving, and when she yelled, it would come flying out.
Okay.
She loves her implants.
Does she tell you that on the consult?
Yes, she did. She did. That was one of the reasons. She grew up in a foreign country, did not get the best of dental care, and lost some teeth. So the dental implants have been a blessing for her. But she's also a professional person who feels comfortable speaking now and not worried about that partial dentures shifting around or that front tooth not looking just right.
So would you say in your state there's tens of thousands of people wearing an upper or lower denture?
Of course.
Over 100,000 people wearing an upper or lower denture?
20% of the population, but it's going down.
So if it's good as you say it is, okay, and if there's all of those denture wearers, why aren't they all doing it, in your opinion?
In my opinion, they don't know what their options are.
Okay.
They think they have had this for years. The doctor has told them they didn't have enough bone, but they do have enough bone. We can demonstrate that. We can show you that with 2 implants, you can feel more comfortable, eat better. With 2 or 4 implants, you can do even more. You can cut out that palate so you can taste food again.
Okay. Do you think they're afraid
Oh,
of the
of course.
the denture wearers?
Of course. Dentistry has changed so tremendously in the last 20, 30 years that I've been a dentist. We have sedation. We have ways of making you feel comfortable. 90% of the patients, 95% of the patients are back to work the next day with 2 Tylenols.
It seems very painful.
Oh, well, I speak from experience.
Okay.
I lost a bicuspid here to a nut. Well, it was probably already cracked, but who knows. Anyways, Friday afternoon, I went in, my associate put an implant in, and he had to put some bone in the sinus even. It's called a sinus lift. I didn't have enough bone there. So put that in. That evening, I was out there with friends. Took 2 Tylenols.
So they put an implant the same day?
Same day, and I went out.
What about a tooth? And you had a tooth put on the same day?
No, I waited for that.
Okay.
I did wait a little bit longer for that, but it was in the back. You couldn't see it.
All right.
I went out to dinner Saturday night. I went out to dinner Sunday night. Nobody knew I had a dental implant until I told them. There was no bruising. There's no pain receptors in the bone.
Okay.
Pain, and sometimes when we do the 3-dimensional imaging, it tells us where to put it. We don't even have to touch the gums. Don't have to lift up the gums. We can put the implant right through there.
Now you have a CAT scan right in your office.
Yes, we do. We have 3D imaging, which shows us the position of the implants ahead of time, and we do plot everything ahead of time on the computer before you get in that dental chair. We had one patient, a professional man came in.
All right.
He was a wine taster. He loved wine, but he couldn't taste it anymore because of the palate.
Oh, you mean the okay? The palate's covered when you're wearing
The palate was covered
denture.
with the upper denture. You need it for suction to keep it up. So, what happened? 2 o'clock. He came in. We didn't do any sedation. We just numbed him up. That's all we wanted. Put 6 implants in. The family dentist came over, put 10 teeth on top of those 6 implants.
So like a whole upper?
The whole upper. He replaced all the teeth. A couple of screws to hold it in. That night, he was eating meatloaf and mashed potatoes. Now, you do have to have soft foods for 4 to 6 weeks. I mean, it's not, you're going to get right to the apple.
Okay.
But he had just Motrin, 800 milligrams of Motrin, took care of any discomfort he had.
So pain is not something that they complain about?
No. In fact, everybody hops out of the chair and says, is that all there was? We even had coffee mugs made. It says, it wasn't as bad as I thought.
All right.
So your imagination, and of course your neighbor's going to tell you all kinds of weird stuff. People love to do that. But no, they all hop out of the chair and say, it wasn't as bad as I thought.
Okay, I mean, so like virtually painless, so we don't have to put disclaimers all over the place. But pain is not a big part of what they complain about.
No.
I mean, some people aren't even on medications the next day.
Usually you're on medication for 2 or 3 days. That's about it.
Okay.
And mainly it's because you just want to make sure it doesn't hurt.
All right.
But myself, my own experience, I was only on for Friday and Saturday, and by Sunday I wasn't even taking anything. There was no bruising. Yeah, that you can't guarantee that, but yeah, it's rare.
So why is it what used to take you guys 9 months or a year, as far as dental implants, now can happen in a few visits? What's changed?
Well, for one thing, those $3 and $4 million 3D imaging machines are now priced where the average dentist can have them in their office. So we can plot everything on the computer for positioning and everything.
So you have guides in certain cases?
We have guides. We have surgical guides tell us precisely where to place them. Now, the surface in the implant is different. They have done surface techniques where the bone has a greater affinity to adhere to the implant, and they have special solutions now that they store the implants in, which promote bone growth.
Is that right?
Yes.
Interesting. Okay.
So this is all new stuff. And now we also have plastic membranes that we can put over it to hold everything in place. And this is all stuff that came out in the last 2 years. I mean,
So these are the things you're talking about when you're teaching other dentists and lecturing to other dentists?
We're on the cutting edge.
Is that right? Is that where, I mean, you believe that?
Oh, yes. Oh, yes. I'm having fun. I do over 100 hours a year of continuing education, keeping up with everything. And these new techniques, it's just mind-blowing where we'd be able to do it. We couldn't do even 5 years ago.
One of the things, I guess, we talked off camera. One of your few frustrations, you say, is that oftentimes if somebody goes to one of these chains that does dental implants, that they may be too quick to pull out teeth and just give you dental implants. Elaborate on that. Now, I want to make sure I don't put words in your mouth there.
I don't think that is the best choice. The best choice is working with the team of dentists that are local or going to follow you through and be there for you if you have any problems. Because not only after we place the implants, we have this wonderful team of hygienists who will walk you through how to stay healthy and be healthy and will give you anything you need to stay healthy.
Okay.
Where the chain, once you're out the door, you're out the door.
Okay.
They don't follow you. We have patients, we have done implants, we follow for 5, 10, 15 years to make sure everything stays healthy and status quo.
Okay, good. Now let's talk about categories of dental implant patients. I mean, if you had to say that, what are the different kind of patients that you see that require dental implants or could benefit from dental implants?
The category of patients that benefit from dental implants, anybody that's missing a tooth.
Okay.
Except for the wisdom teeth, we can replace them about anything else. So we have the young guy who got into a bar fight, lost his front tooth, we put an implant in.
Okay.
We have young ladies who have congenitally missing teeth, which my own son has one missing.
Interesting.
Young patients can have implants, but they have to stop growing. So around 18 for females, around 20 for males, we can start putting implants in.
Okay.
Because while they're still growing, you can't have the implants. But up to one of my patients, 86 years old. She wants to have the implants. Why? Because when does she see her kids? Easter, Christmas, Hanukkah, the different holidays.
How old?
86.
An 86-year-old got dental
And
implants.
well, when she sees the grandchildren, she doesn't want that denture flopping around. She doesn't want them to know she has denture, and she wants to be able to eat everything on the table.
Okay.
So she
okay.
feels very comfortable now with the implants.
So that's interesting. So you're not too old at 86 to get dental implants.
No. And why not? I mean, you don't want to leave the money to the kids.
I mean, the phone. I mean, the phone. So the implants won't fall out. I mean,
No.
even if you're 88, if you're the right candidate and you do the imaging, you could do it on an 88-year-old.
Well, we have older patients. We do imaging, and when we do this 3D computerization, we can also do bone density. So we can tell if they're a candidate or not ahead of time because of the computerization we have
But you've
nowadays.
had most people that are candidates, right?
Oh, yeah.
I mean, it's
almost
rare that somebody is not.
It's rare.
According to you.
It's rare. In the last 3 years, I think I've turned down one patient. I said, you really just don't have the right kind of bone in the right place. But we knew that ahead of time. We didn't have to pull back gum tissue and take a look. We knew that from the computer. That's the beauty.
Now, but what about this? Okay, knowing you're coming on my program, okay, asking around. What about people that have been told their teeth have to go because they're loose, they're bleeding, and their gums are bad? Mm-hmm. Are they candidates with bad gums for dental
That's
implants?
the perfect candidate. You want to catch it when they first have the teeth out, because once the teeth are gone, the bone starts to resorb. There's no stimuli. All you need is a little piece of bone.
Even if they have infected gums, though.
Oh, we clear up the infection.
All right, okay.
Okay? And when you clear up the infection, maybe some of those teeth can stay. Who knows?
All right.
But you don't know until you clear up the infection. And then you make a decision. Which ones have to go, which ones can stay. And you want to get those implants in as soon as possible. Within this first 6 months to a year after the extractions, while there's still good, healthy bone there.
Now, you brought an interesting little bone chart. You say you show this to patients. What is this?
This shows the progression of what happens when you lose your teeth. From here up, the bone is there to maintain the teeth. When you take out the teeth, here's what you have left. Now, you can wear a denture on that.
So the bone dissolves away slowly.
Yeah, that's right. There's
The
no
denture,
stimuli.
okay.
But if I put a couple implants in at this stage, that bone will stay up that high. It won't keep resorbing. So here you are, nice and healthy at 20. Have your teeth out at 40. Here you are at 50. Starting to get sharp ridges, and then at 65, 70, you're ready for retirement and really to chow down with your friends. You can't.
All right,
And
all right.
I'll tell you a funny story. Oh,
But you can still get implants even if you're at that point.
yes,
You've lost
because
that much bone.
there's no nerves on the front here, so it's very easy to get a couple implants in the front here because you don't disturb the nerve. Now in the back here, you would have problems because of the nerve. But again, we know all that because of computerization. So we know ahead of time where we can place the implants and make you comfortable. If you want to hear a funny story
ahead,
about
let's hear
this, when I first got married, my grandmother was from Kiev, Russia, and my father was Roman Catholic. So I was baptized in two different Catholic orders.
All right.
So we had to find a priest, a missionary priest, who could do the ceremony to appease the European people and the Roman Catholic people. So this missionary priest came and married us, and then when he's traveling, he keeps tabs of everybody he married so he can go stay with them.
All right.
So my wife, the priest is coming to stay. So,
and there's a dental connection somewhere in the story,
yes.
right? Okay.
So he said,
okay.
can I bring my brother? And I said, fine, come and stay with us. So he got this beautiful meal, corn on the cob, steaks and everything. He brings his brother. His brother wears dentures. He could not eat the meal.
Okay.
She was so embarrassed, But that's what happens.
So you guys prepared the worst thing for his brother.
The worst.
Can't eat it.
We had to take the corn on the cob and cut it off the cob, and she was so. I mean, if you told us he had dentures, and we could have prepared pasta or something.
But there's a lot of people living like that. It's a very good story. So, tens of thousands of people where you are, that their life is compromised, can't eat the foods they want, can't chew steak, things like that.
Oh.
Can't eat raw vegetables or vegetables.
So
Very well.
Yeah.
Okay.
So they're
Interesting.
It's
Good
very
point.
unhealthy. So, and then, I right down the street, not too far from Johns Hopkins. I treat tremendous number of patients from Johns Hopkins. So the physicians come in, and one of them runs the acid reflux. The GERD, as it's called nowadays. where people have acid reflux. He says, do you realize that most of my patients can come through have dentures? Why is that? They can't chew their food. They can bite it, but they have to swallow it whole.
Yeah.
Then they have to produce.
Do you think they don't even realize that they're swallowing it whole? So they're kind of like just kind of rubbing the food together.
Yeah.
Is that true?
They have to produce more acid, and so it goes up in the esophagus, and they get heartburn.
There's no teeth in the stomach.
That's right. So a couple of implants, they can chew better. They won't need as much medication to keep their heartburn down.
Okay, now we're out of time, but so for the denture wear, to give us a recap. So 2 implants, snap in, snap out.
4 or 6 implants, you have something that's fixed permanently. Doesn't come out. It's there.
A whole arch of teeth.
The whole arch of teeth. Yeah.
So you do this all on 4 procedure. It's called all on 4. That just means like a whole set of teeth on 4 implants.
Yes, we do.
Okay.
That's sometimes the best option, but not always. It's great. You want something to last a lifetime. Often it's better to do 6 to make sure that you don't, if you ever lose one for any reason, you still have all your teeth.
Okay. Now we should mention insurance, Medicare doesn't cover the whole procedure or cover these procedures, but you say, Randy, I want people to know that we can make it affordable.
We make it affordable. We have all kinds of payment plans. If you can afford cable TV, you can afford an implant because we set up payment plans. And I tell the girls, make it work. See what you can do to help these patients. And we do everything we can. We bend over backwards because I want people to have health. I care about.
Is this the happiest group of patients? I mean, look, you're a periodontist. You deal with a lot of gums and a lot of surgeries. But over the years, when you get people, I guess, no more dentures.
I think no more dentures is the happiest. The first happiest is the people with gummy smiles. Because it's just instant. They look at it, they go, oh my God, I should have done this 20 years ago.
All right.
And because it's so instant. But people, when they realize that now they can chew and talk professionally and not worry about food and not worry about sesame seeds getting caught underneath their denture, and they can bite into meat and not have their denture move.
Is there such a thing as a happy denture wearer? I know a few denture wearers, they don't complain to me. Or I never heard them complain about it.
That's because you didn't make dentures. As a family dentist, I made dentures.
Okay.
I did a fairly good job, okay? And they leave and they said thank you and all that. But I sort of felt like a divorce lawyer because even though the results, you got where you wanted to, everybody, but nobody's quite that happy,
Okay.
Yeah, yes, I know I needed it to do it, but it's just the best you can do,
Okay.
So I swore I never wanted to make a narrow denture. Maybe that's why I went to become periodontist.
So denture wearers, they just don't know what they're missing then?
No, they don't.
So if there was a try-in period on a Friday for just 2 implants, are you saying they could never go back?
Oh, no, they never would. I have never seen anybody say, "Oh, I'm sorry I got the dentures," or "I'm sorry I got the implants." I'm sorry, but I never heard anybody say that.
So eating and chewing and smiling and
speaking.
You said so. We are out of
tasting
time.
Food again. I mean,
when I first met you, I thought, especially with your enthusiasm, I thought maybe you were exaggerating a little bit. And people need to know this is a real interview. This is not a big planned out process. And I'm not even trying to endorse you, but you say you're changing people's lives.
Oh yeah, it's every day, and I'm doing it. And I'm in the back of my mind, I have that story about my mother and father wearing dentures and what they had to endure and all the problems they had throughout their lives. And I swear, my patients are not going to have those problems.
So in a perfect scenario, okay, everything's right. 60-year-old watching this, they have upper and lower denture. If everything goes right, how soon before maybe they can have teeth that they could eat with, a full arch of teeth?
Realistically, about 6 weeks.
Okay, about a month and a half.
About a month and a half, and then they're loving you. They say, oh my gosh, why didn't I do this years earlier?
They give you cards and things like that?
Yeah, they send me Christmas cards.
All right.
We get Christmas cards and we get gifts. We get a lot of cookies.
And they're never left without teeth, right?
No, you leave with the old dentures in place, and there's a period of healing.
Okay.
I can't speed up, what God had decreed as bone healing time. It happens.
Do you ever get people that say, my medical doctor said that I'm too old for dental implants, or I was told by another dentist I didn't have enough bone?
Yeah, that's the old days.
Okay. But does it still happen today?
Yeah.
The patients are told that?
Sometimes.
Okay.
Yeah. Yeah, and you have to realize between the lips and the tonsils, the physicians have never been trained there, and
Okay.
they really don't know what we do. And I have tons of them as patients. They're not the best patients, by the way.
Okay, is that right? Okay, good.
Yeah, also some of the nurses and dentists I treat aren't so great either.
Do you treat other dentists?
Oh,
that
of
come to
course, of course. We have dentists that come in to see us every 3-4 months to get their teeth cleaned because they don't have a dental hygienist in their office. They don't have somebody, especially the specialists.
Do people travel to see you? Because, I mean, you're a lecturer. I mean, you teach other dentists about dental implants.
We have, I have somebody flying in from Minnesota in 2 weeks. She's an old patient. She'd like this.
Okay.
But tremendous number of patients come from the Eastern Shore, from Pennsylvania, from West Virginia. Yeah, they travel.
Good for you. No More Dentures. Well, we're out of time. I want to thank you for coming on the show. Very interesting.
Well, thank you.
Good job. And if they want to see this interview again, you're watching The Wellness Hour. I'm Randy Alvarez. If you'd like to see this interview again online, go to our website and just put in Dr. Daley. We'll also have it on YouTube, and we'll give you a copy to put on your website. Thanks again. Very good.
Thank you.
Good. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.